Good day, dear great surgeons. With you, Dr. Bishoy, specialist of plastic surgery in Egypt. Today, we're gonna talk about MRCS and how to master MRCS with our group. I will make this brief as much as possible to answer all of your questions. I'm sure most of you have been going through MRCS articles and reading about MRCS before going through this exam for whatever reason you are going for. And today we're gonna talk about MRCS from our group point of view to answer most of your questions. So, how to master MRCS? Is the screen playing through all of your devices? Can you see the screen?
Yes, we can.
Yes,
That's
we can
great.
see.
So, today we're gonna talk about what is the MRCS and why to take MRCS and what is the exam style and format, how does the exam come, and what is the study plan and when to start this study plan and what are the studying material recommended and where to find it, and if there is a secret bank, where to find it. And of course, if you are going through MRCS, you have been going through the name Fausa. Who is Fausa and what is the secret about Fausa and what not to do in MRCS study plan and what are the must topics in the exam and the pass rate of the exam and do I need a course or not. Those are the main topics we are gonna talk about today. So what is MRCS and how to submit for it? MRCS is a surgical diploma, is essential for whatever your surgical specialty is. You have to take MRCS to pass your exam and be a registrar there or start your surgical training or even a service job in UK. And in our countries, MRCS might be diploma, surgical diploma, which might be recognized by some countries and other doesn't recognize it at all. So make sure is MRCS recognized by your country or not before taking it for local purposes. And how to submit for it? Simply go online for the Royal College site and submit for the exam. As simple as this. It will be simple steps. Just need your English certificate, the official English certificate, and email it online. And this will be the whole thing. And of course, don't forget to pay the fees. It's important for them more than your certificate, in fact. So when does the MRCS takes place? Normally in January, April, and September. 3 times per year. This is regarding Part A. For Part B, right now, there is no Part B outside UK. It's only in UK for now. A famous question, is there any difference between the colleges in MRCS Part A or Part B? We know that there is Edinburgh, England, Ireland, and Glasgow. There is no difference for Part A. But regarding Part B, there is a difference. But right now, there is no Part B outside the UK. So we are now talking about Part A. Whatever college you are affiliated to, there is no difference in the exam. It's all the same and takes place at the same time wherever you are, whenever you take it, all at the same time. So why we should take MRCS or why it's recommended? Some take MRCS to immigrate to UK or to work in Ireland or Glasgow or whatever country recognize MRCS. Others take it for surgical diploma, which is recognized nationally in his own home country. Others take MRCS to work in UK and gain experience and then take it as a backdoor to travel to Australia. For me, I don't recommend you to take MRCS just to immigrate. It's a personal belief that you will bloom wherever you are, but take it aside and just focus on your exam. You can do whatever exam you can do and win it. I believe that Every certificate you can take it and certify your knowledge. This is a rule as well. I believe in it. So, what is the exam style and format? Previously, it was a paper style just like you see in the screen, but now it's online exam, just like you see it. So, you will be dressed like this and take your online exam. And by the way, this is the exam soft, just like the exam you will take. Is it a good thing or a bad thing? In fact, it's a good thing in many ways. Um, it will be more familiar and more easy to take, and you can organize your time. There is no need to travel to another country to take your exam, just from your home with your own laptop and your own home, your own familiar room you used to study in it. And if you take frequent mocks like the exam, you will be taking this exam like your daily routine. So it's a great privilege and good impact. How it can be bad, some think that some may use this in a bad way, like some took advantage of this online exam and took screenshots of all the exam and have been selling it. But I want to stop in this item too much and let's talk more specifically regarding the exam. We are here as a surgeons and respected surgeons to study together to help to pass and be toppers as well. So the exam had 300 questions in 300 minutes. It's like 5 hour long exam divided into two papers. Paper one, which is basic science, about 180 questions, and you have to solve it in 180 minutes. And the second paper is 120 questions. You have to solve it in 120 minutes. 5 hours long exam. If you are not used to this exam long period, we will crack this together. So it's a time marathon. Take care. There is a big idea behind the MRCS study. There is a plan and there is a mark distribution you have to be familiar with. You have to know that you have 75 questions out of the 300 questions are pure anatomy. Not this only. The anatomy questions are subdivided into subtopics, and every topic have a specific question. And luckily, and thank God, they are respecting this mark distribution. So you have to study smart rather than hard. Every topic have its mark distribution, and many waste time in unimportant topics, just like embryology. There's no need to waste your time in embryology when you know that there are about 4 questions and recurrent questions are coming in the exam and study and make an MD in embryology when it's only 4 questions out of 300 and you know that 3 of them will be recurrent. That's why you have to be familiar with the smart distribution. Take care again. You will find that 45 questions are physiology, but I'm not good at physiology, but take care. The 45 questions of physiology, you will be knowing at least 30 or 40 questions from them because there must be glaucoma question in the exam, ECG question in the exam, and don't panic when you hear ECG or ABG or even glaucoma scale because you will master it during your study. They are recurrent direct questions. They don't need you as a mastermind in surgical basic science, but to be familiar with the most recurrent basic science. Won't take much in the surgical item distribution and mark distribution because you can be familiar with and we will jump to them together when we are talking about the recurrent topics and the must topics in the exam. But I want you to focus that they are respecting those mark distributions and the tricks will be told in time. So, what is the exam study plan exactly recommended? We have a 3 months study plan or 6 months study plan. Of course, the earlier the better, but the least time required for this exam and recommended is 3 months. Below 3 months is a little bit tricky. especially with the online exam, have been going through many changes, and I suspect that they will go with changes more and more. Lately, they have been increasing the photo questions, a photo and question about this photo. But luckily, the photos came in the exam and the images came in the exam were up to 3 photos and from previous exams. They are recurrent records. But with time, I suggest that they can increase them. As well, 3 months exam are the preliminary required to have time to go through all the knowledge needed. The too long period is not recommended because the longer you might get lazy and get your schedule loose. You say, I still have time. This is not very recommended. So don't make it too loose. Don't make it too tight. Make it suitable, like 3 or 3.5 months to be familiar with the exam. When to take the exam? This is a critical question. What does this question mean? Do you mean when to take it, like when to take it, it's suitable for you, it's your answer. You have to answer this question yourself. You have to be dedicated through these 3 months to have a daily target in your study plan. If you don't have a daily target, can be fulfilled during your 3 months, so it's not recommended to take this exam in this time. So when in your life career, the earlier the better. As long as you are fresh graduate, the most basic science are in your mind. But when you are older, it's not that easier to take the exam. You can still have a chance because there is a scope for the exam. If you study the scope ideas, you can do it. And if you are asking about the exam timing, we told you and we agreed it's in January, April, and September, 3 times a year. So, what are the studying material recommended for MRCS? There are about several and many innumerable sources like EMRCS, question bank, past test question bank, on exam, RCS revision tools, and they are getting a headache when you hear about those old sources. And I'm sure many of you have been going to download millions and tons of files. In fact, all what you need is not all of this. In fact, you have to need EMRCS, BASTEST, Fausa and records, and Google with NHS and the study groups. These are the recommended in order. Regarding the 2 papers, EMRCS is strictly recommended and highly recommended for both papers. It has the basic knowledge required for knowing the MRCS exam. Eventually, every one of you with studying only EMRCS will get above 60% from the exam mark. But the pass rate in the exam, the pass score lately became above 72%. So to gain those 12% and more, not EMRCS alone, you have to go through records and pass test. Regarding pass test, not the whole pass test, but in a specific way, we can talk about it later. So all you need is EMRCS and pass test for paper 2 and records, as well as your friend, Dr. Google and NHS guidelines. And of course, your study group, either ours or your own. Those are the recommended surgical materials. So is there a question bank, a secret question bank? In fact, there is no question bank secret because records are the questions that came in the exams and every candidate passed to the next generation. This is the secret bank everybody has. If there is a secret bank to be found, is that someone has took a privilege and this is against the law to photograph the exam and sell it in form of a course or in form of a file. So let's stop here and not talk about it more. There is no secret bank. It's only records, and you will recognize it after your exam and remember this well. So, who is Fauziya and what is her secret? Fauziya is a famous record, a famous question recurrent in the exam. About set of 300 questions in every exam, minimum to have 15 up to 50 questions in your exam will come from those records. Why? It's statistically came in every exam from 15 to 50 questions. That's why they are important. And by the way, don't be puzzled during your study when you find that some questions there is no definitive answer known. They are known question debatable. Only the RCS knows the answer for those debatable questions. So, Fauziya is a group of Sudanese people who thankfully shared their 300 crack records that every exam contains at least 15 to 50 questions in the exam. Just if you studied the record whole, you will just like studying the whole exam. And by the way, if they change the form of the exam questions that came before, you will know the answer if you know the concept. That's why during studying MRCS, don't focus on memorizing the question as it is, but understand the idea. And to understand the idea, you have to read the explanation and Google for it. So, where to find the data of MRCS? There is the online data when you are subscribing for the banks like MRCS or Pastis because they are paid banks. And by the way, MRCS is affordable and Pastis is a little bit costly, but you can share it with your friends or the offline data with our famous interactive guide schedule. The interactive guide schedule will take you in a ride to save your time. Please read its introduction carefully. I won't waste this webinar time in explaining the interactive schedule because in fact, the interactive schedule already explaining itself. So every interactive schedule have all the data you need, everything needed already in the schedule from guide notes, from study notes, from the question banks, even the records, and telling you what to do every day. So again, the interactive schedule will be your guide through this journey. Hope you read the introduction of the interactive study schedule and it will be helping you too much. What not to do and why some surgeons didn't pass from the first attempt. Simply, you have to follow a plan, have the study materials, and be consistent as well as do revision and do sharing. This is the secret for MRCS pass. But let's have a look about a list of what not to do list. Never study alone and never use a textbook without MCQ bank. This is a big secret for MRCS. Never lose your study schedule and never skip a mock. A mock you will find in your study schedule and your study schedule must contain a self-examination, but never test yourself before studying. And never read a question and test yourself in the knowledge of this question before reading it pre-answered. Why we don't recommend studying a textbook even for anatomy? For all of you, do you know the blood supply of the scaphoid? Is it distally or proximally or from where? This is a very famous question record in the exam. And for another question, do you know the relation between the operator nerve and the pelvic operation or even the nerve urgentis with the pelvic operation? Can you find those ideas in the textbook of anatomy? Of course not. To understand the concept of those questions, you have to know the problem found in the MCQ and reading the explanation for it. But if you go for the textbook for the anatomy, it will not focus on those ideas as the MCQ focus on it. And never forget to revise what you have already studied. And never study all the files. And thank God, all your friends or our previous surgeons were selflessly giving all their files they noted by themselves. and all updated. Never waste time on a low bulk hard new question. If you found a new question, don't make an MD on it. Never make a paper on it. Know the idea and pass. Don't waste your time in the short chapters and never make the exam your first time to self-test. Many skip the mock and never take the mocks and they make the exam their first time 500, 300 questions. This is not logic at all. Please never depend on a course if you took one and never distract yourself in your early days. Please focus on your study schedule and never stop believing in this new study style that you are studying from MCQ, not from textbook, and taking screenshots and revising and searching for the explanation. This is the new study style you have to believe in. And never give up helping others. The magic 5 secrets for passing MRCS is study. The study tips and tricks. Have a study group. Take screenshots. By the end of your study first wave, you will find your screenshots are your gold mine. Please share. Sharing is your secret for passing MRCS exam. Bishoy might know some ideas, but Ahmed might know more ideas. If Bishoy shared his ideas and Ahmed shared his ideas, Ahmed and Bishoy know the ideas of both. How about if Miriam added hers and Katrina added hers? We have the ideas of 4 candidates. If everyone shared one idea per day in a group of 10, we have at least 10 new ideas. How about a group of 50? And by now, we have at least 60 participants in this webinar. As 30 new ideas can be added. I have studied a chapter. I shared one question. It was query and I don't understand. You can explain it for me. And another thing, I am not orthopedic, and many face many problems with orthopedics. So the orthopedic friend can share with us more practical way to understand the idea behind the orthopedic question. I am a plastic surgeon, so I can explain for you the idea behind the plastic surgery question. This is the idea about sharing. So by sharing, you can understand it for me. Search on Google for in introduction and for explanatory illustration to understand especially anatomy. Anatomy requires explanation. And Dr. Google, believe it or not, in the image section, you will find a gold mine for every illustration you require for your understanding the anatomy regarding the MRCS scope. And lastly but not least, search for NHS and NICE guideline, like the rehabilitation and the early mobilization and the early recumbency, how to know those guidelines if you are not practicing in your country. Search for it on NHS and NICE guidelines and you will understand. Those are the 5 S secrets for MRCS. You will understand it and remember it by the end of your exam, by the way. What are the main topics and the pillar topics in the exam? Number 1 and 2 and 3 is the anatomy. It's the main bulk and overlapping with many chapters. And you will be surprised that your exam is not about surgery, not about general surgery. It will be like a trauma exam, orthopedic exam, and the pre-operative and post-operative exam, and sometimes vascular. So focus on anatomy, trauma, and orthopedics, especially the pre-operative and post-operative as well. Those are the pillar topics in the exam, and you will remember this by your exam, by the way. So don't get caught. The must question in the exam. You will be entering the exam having at least 85 questions, where 75 questions are anatomy pure from your knowledge, you know them, and 30 questions at least from Fausa, and 30 questions at least from the records. So you are entering the exam having 180 questions. Let's add about 50 questions will come in the exam, like the dermatomes, the lymphatic drainage, injuries, as well as the vertebral levels and the formula of the skull and the embryology. And believe me, you will be familiar with them. And to know by now that those questions will come in the exam, you will master them and focus on them while you study. And when you go through records, you will understand it all, as well as the ABG, electrolyte imbalance glycemic coma scale, as well as the ECG. And the ECG, don't panic from this word. You will understand the ECG, and you don't be having a MD in cardiology to understand it. They are asking about waves direct. The B wave for atrial, the atrial repolarization is masked by the ventricular repolarization in the BQRS. These are not a Harry Potter spell, by the way. You will understand it when you read it. And the vitamins, like the vitamin C for collagen, the vitamin A for densalasma if deficient, vitamin D for the calcium, and the SIADA and its differential diagnosis, as well as the respiratory function. In every exam as well, there will be a wound management, the fracture pattern, and pediatric orthopedic, as well as congenital GIT problems. So the pediatric chapter is important, and the parent equation is a must. And they follow the ATLS latest edition, and now we are ATLS 10th edition up to now. The stats and consent and audit, they are not a big deal. You will know the recurrent question in your exam, and you will know it. So your crack to understand all those master questions is to revise those question mark distribution and make them guide you, not to panic, but to be safe. Those are not a nightmare. Those are your guide to someone telling you, I will get those questions. And you will study those and enter the exam to find them and answer them. What is the need to be panicked? Okay? So the pass rate of the exam. The pass rate of the exam normally went through interval from 70 to 72. This was before the normal up till last January. But take care. In September 2020, it was a nightmare for all MRCS candidates. And I believe this was by mistake from the Royal College. And they didn't repeat it in last January. And hopefully, I believe they won't do it again with April candidates right now. It was about 77% to pass this exam. It was the highest pass rate ever. And that's why in our mocks, we have been training to be the pass rate at 80 and above. And I believe you have to train above 90%. How this? By taking the tips and the tricks we talked about. Study, revise, be consistent to your schedule, take your mocks, and you will do it. Do I need a course or not? And what does the courses offer? All the positive idea regarding any course you are going to join will be the time management. Some people tend to be consistent and dedicated when they take. If they need someone to take their hand and spoon feeding during the exam study because they have paid for it. If this is the case, go for it. If not, you can go through the proactive study schedule and be consistent with it and dedicate for it. Now we have open discussion. I will generate